everyone. It's Marissa Lachlan from Joanne's Place here, and you're listening to the Wellness on Purpose podcast. There is no linear path along one's wellness journey, and it is very easy to get caught up in the latest health trends found on social media, which tend to redirect our wellness journeys. Things like, what's the difference between clean and dirty eating? How should I reduce my stress? How do I know if I'm regular? How much sleep should I be getting? What even is cortisol? And do I need to be taking a multivitamin? There is so much information being released in the wellness industry on and offline, and it can be very challenging to not jump on every bandwagon we read about. Here at the Wellness on Purpose podcast, our intention is to connect with experts in our community to inspire and educate you to take the next impactful and realistic step in your journey to live wellness on purpose now and for future generations. On today's episode, we're talking with Dr. Shayla Conrad, who is the owner of Hybrid Health and Rehabilitation here in Peterborough. She is a chiropractor and acupuncturist who provides evidence-based care by incorporating a variety of techniques to help her patients restore loss of function, movement, and to help with injury prevention. Stay here and tune into the rest of this podcast to find out how Shayla can help you along your wellness journey. Hi, Shayla. Welcome to the Wellness on Purpose podcast.
Thanks for having me. I'm excited to be here.
Good. So I just want to start right with you telling us a little bit about yourself.
I am a chiropractor currently practicing here in Peterborough. I grew up in the Maritimes, Moncton, New Brunswick, to be exact.
Oh, wow. When did you move here?
Well, from Moncton, I did my undergrad at Dalhousie University in kinesiology, so that was 4 years, and that's kind of where I decided to move on to chiropractic college, which is in Toronto, and where I actually ended up meeting my husband there, so he's from Peterborough, and that's kind of what brought me here. So I've been here now for 3.5 years. We just recently on March 1st opened our own clinic, Hybrid Health and Rehabilitation, and so that's kind of where I'm at now.
That's awesome. Mm-hmm. Do you go back home a lot, or has your family moved here? Or
No, all my family is still out east. It still holds a very large place in my heart. So like my parents are there. I have a lot of aunts and uncles and cousins. We try to go a couple times a year. It is hard, but it's a quick flight. It's about 2 hours from Toronto, so we try to get there really as often as we can, every other Christmas, other holidays. Definitely in the summer, because you have to go to the Maritimes in the summer.
Yeah.
That's when the weather is absolutely the best. And I miss it, but I find Peterborough actually quite similar to Moncton.
Yep.
Just like population-wise, size-wise, just the general overall feel. So, yeah, so far it's been great.
That's awesome. So you've been a chiropractor now for 3 years. Mm-hmm. And before you were a chiropractor, like, did you always know that you want to be a chiropractor, or is that just kind of, like, where did that start for you?
Well, I started my undergrad in general Bachelor of Science. I kind of thought I might want to be a pharmacist for a little bit. I have a couple of people in my family that are pharmacists, and that's kind of why I went in that direction. That's kind of what I knew. And then after my first year, I didn't love it, and I honestly even looked into accounting. So I was all over the place at the end of my first year. Not super sure what I wanted to focus on, not sure where I wanted to go. And then I had heard about kinesiology, which, to be quite honest, I had no idea what it even really was. Mm-hmm. And so I looked into the program, ended up switching to that program from my first to my second year. It's still a Bachelor of Science, so my first year did me well. Like, I was able to just transfer, and it didn't put me any further behind. And then throughout kinesiology, I just started really kind of understanding the human body and focusing a lot on anatomy, like physiology, biomechanics, and I was honestly just fascinated, like, if I'm going to learn anything, why not it be about me? Yeah. And about the body and about others. So I was tutoring a biomechanics course for a year in my last year of kinesiology, and that really kind of hit things home where I was like, okay, I think I need to learn more about this. I think I need to progress further. And I met a couple of chiropractors in Halifax. Again, I didn't know a ton about them. They were a husband-wife team, which kind of is funny how things ended up.
Yeah, really.
But they were absolutely fantastic, and that's what sort of pushed me to go to the chiropractic school in Toronto.
And is there only one chiropractor school, like, in Canada, or?
Yeah, there is one English-speaking one in Canada, and they accept about 200 students a year. And then there's a smaller French-speaking school along the Quebec border, I believe, and they're much, much smaller.
Smaller, yeah. So 200 people a year, and then the chiropractor course, how long is that?
That's another 4 years after your undergrad. And it's 3 years of pretty intense studying, and then a full 12 months of clinic. Yeah.
And could you pick your clinic anywhere, or?
They kind of had clinics through, like, there's a big clinic in the school where people could go, and you essentially treat under a current practicing chiropractor and as your clinician. So you could be there. There was a couple feeder clinics downtown Toronto. There's one in Burlington. So they just had a couple like that. And once you completed your hours and your amount of treatments, you could do some externship at a chiropractor in your hometown or somewhere like that. But it mostly was within the school, and you had to rank your clinicians with who you wanted to learn from, and that's sort of where you ended up.
So when you started your first year in chiropractic school, is that when your husband also started, or did you meet him later on?
He actually was a year ahead of me.
Okay.
So I met him in the gym, really, for the most part. He might say a little bit different, but that's sort of where we started talking, and things went on from there. And really, again, why we ended up kind of putting down roots in Peterborough, because he graduated a year before me. I was still in clinic. So I was going back and forth from Toronto to here, and then when I graduated, it just didn't seem like the right thing to do to say, oh, you've practiced for a year, let's move somewhere else. And as I mentioned, my family's all over the Maritimes, so I didn't have one spot that I was necessarily needed to go back to. So
that's awesome. Do you love being a chiropractor?
Yeah.
What's your favorite part?
Helping people in general, having people come in, and I mean, obviously there's difficult days and tough cases, but on a day-to-day basis, I love the positive feedback. I love people that get excited about what I'm telling them, and I get excited to get up and go to work every day, and I mean, every day is different. I don't necessarily know what I'm going to face in a given day, but that kind of adds to why I love what I do.
Yeah. So during your treatment sessions, like, obviously chiropractor adjustments, but like, what other things do you offer during a treatment?
It really depends. It's quite patient specific. So within any given assessment that I might do with someone, they come in, I'll chat with them for a while, kind of understand what's going on, what their goals are, what really they're looking for in a treatment, what they might have had in the past. I do a full physical exam so that I can kind of understand what structures might be causing their issue, dysfunction, pain, whatever that is. And then I come up with a plan based on that. The plan can absolutely include adjustments, mobilizations. I do a lot of soft tissue therapy. I'm really big on exercise. That's a huge focus of my practice, where I give an exercise based on kind of what we've come up with so that they can work on that in the meantime and really try and fix the problem, because the passive care is fantastic and feels good, but probably in the long term things aren't going to change if they don't work on those exercises. So that's really where I focus a lot. And then in addition to that, I do medical acupuncture.
Okay.
Yeah.
So with the exercises, how compliant are people with them?
It really varies. A lot of the time you can really tell when someone has not done their exercises. Not that, they're absolutely always going to work for everyone, and that's the reason that people will come back and we'll kind of review them and say, okay, let's try this. But the people that get really excited about what you're telling them and understand, and again, that's why it can be so different patient to patient, and I can have different conversations with them, obviously, to what's going on. And when they understand what's going on in their body, then they understand why they're doing the exercises. They're generally more likely to complete them.
Yeah, for sure. Yeah, that's good. What would you say is like your primary, or what's like the most common health issue that you deal with?
That's a good question. I mean, it can be different week to week. Like, I kind of sometimes joke, like, this week is ankle week.
Oh,
Everyone
yeah.
has rolled their ankle. Or, but probably if I had to say, headaches are a big one.
Yeah.
And low back pain, really any type of low back pain.
Yeah.
Is what I see a lot. And that's what people associate a lot with chiropractic is, oh, my spine, let's work on this, when really we can treat any joint in the body.
Yeah.
So
I was just gonna ask you, like, ankle, like what do you do for like an ankle, or like immediately my first like thought is, I want to get my back cracked is like it. And I know that's totally not it, but that's like where my head goes.
And that's what a lot of people find with chiros. Like, they're gonna go and you're gonna adjust your back, and then we're gonna move on, and that's a fantastic tool to have in the toolbox. But I mean, you can also adjust the foot and ankle. The foot, it has a lot of joints in it. Along with the ankle, lots of muscles, things going on there. So you can adjust the foot in many different places.
Yeah.
And then, you can do any other type of therapy there as well.
Yeah.
So.
And so headaches. I know a lot of people that will get adjustments, and I actually saw a chiropractor many years ago, and it was because I had chronic migraines, but it wasn't even an adjustment he would do this like weird pressure thing with my head in like whole different spots. He was trained in a bunch of different things. I don't know, it was a long time ago. But like, what type of adjustments or like what type of things would you do for someone who had a headache? Like,
well, the first most important thing with that is to assess them and kind of determine what type of headache.
Okay.
There's so many different causes of headaches. There's tons of research out there on, this is this type of headache, this is why, but there's also a ton of overlap.
Yeah.
So it's really difficult to find exactly the root cause of that. I mean, we definitely have lots of tests and lots of subjective and objective measures to find what one it may be the most. I've also come across a lot of people that have two types of headaches.
Yes.
So I would say if we're talking about what I see the most, it's kind of more of like a postural, what they might call a cervicogenic or tension headache.
Yep.
Where your headaches are caused from your muscles.
Yes.
Being tight, and that comes in from a lot of desk workers. Honestly, even some younger kids with their cell phones and iPads, just always looking down at them. So that's a big one.
Yeah.
It really depends how or what type of headache it is, and that's how you would decide how to treat it.
Yeah, that's awesome. And in your like wellness journey, like when I say wellness journey, I like just refer to that to everyone's life. Like, it can be anything. Like, I mean, it can be your business, it can be your home life, whatever that may be. But like, what are your tools that you use to kind of keep yourself aligned and feeling good and healthy and happy?
I mean, I'm huge on movement. I kind of over the years, I mean, going to chiropractic school, it was honestly kind of a setback for things like that, because you just sat in class for 8 to 10 hours a day, and then you went home and you sat and you reviewed everything, or you studied, things like that, especially the first 3 years. So that was maybe kind of an obstacle to moving. Graduating from chiropractic school, I got a much better routine as far as exercising, and that's kind of been something that I incorporate into my everyday life. And I have 2 dogs that I walk all the time. Yes. Kind of an overall movement base, because if I don't move in a day, I struggle. I'm like, I need to get out and exercise and just feel good, and it just makes my body feel great. I think it's important for my work because it is pretty physical. Yeah. I'm on my feet a lot of the day. I'm lifting people's legs and hips and putting pressure through different muscles to do soft tissue. So I find if I get in any kind of rut where I'm not doing movement, then I kind of suffer at work. I mean, along with those things, I try my best to eat healthy. I know everyone probably says that. So I kind of live by the whole 80-20 rule. Good. Yeah. Where most times during the week I'm really on course, and then on the weekends I might have a treat or two, but I supplement it with movement and exercise, and that's sort of how my weeks go. That's
awesome. I think that movement is like one of the most underrated tools in a health box. Like, we always think, okay, like go to the gym, and people are like, okay, let's build muscle, let's lean out, let's run marathons and things. But just moving your body in any which way, like walking, stretching, whatever that might be, is really like one of the biggest tools that is really inexpensive and can be absolutely free, but people don't use it, right?
Absolutely.
And I think you probably see this in your practice. That could also be like a preventative measure that people could take too to, reduce that bad posture or the buildup and whatever that might be, like muscle and tissue and things too, right? So what would you say is like the biggest myth in being a chiropractor that people think?
We sort of touched on adjustments. So I think a lot of people think that chiropractors only adjust.
Yeah.
And as years go by and research comes out, I think more and more chiropractors are doing a lot more. It's as I mentioned before, a fantastic tool in the toolbox, but it is just one tool in the toolbox. And some people come to me and we don't even adjust because that might not be something that's necessary for them and what's going on with them. So.
And you might do like stretching or acupuncture or mobility or something.
Or soft tissue work.
Yep.
Active movement and understanding why when I move this way it hurts. Let's find a way that you can move that doesn't hurt, and we'll focus on that for now. And just really education is a huge part of it too. I would say I'm confident in some ways that someone could come in, tell me what's going on. If we actually just discuss and educate about why we feel pain or why we feel like we're injured, then that's something that we could focus on versus the adjustment or any of those other therapies. So
that's awesome. Who would you say is like one of your biggest inspirations in your health industry? Like it could be another chiropractor, it could be anyone that's living health and wellness.
I've sort of thought about this before, and I do spend a fair amount of time listening to different podcasts and watching people have all kinds of different things on social media now, kind of following along with different people's journeys. And I wouldn't say there's anyone specific that I'm listening to or watching that I'm like, oh yeah, they're all fantastic, but I don't really focus on necessarily one person. And if I had to be quite honest in why I am where I am today, it goes to family. Like my mom, my whole life has exercised. I was raised by just my mom. So I've watched her exercise from when I was a baby probably in our living room. And I think that positive reinforcement, I maybe didn't know it, but by the time I got to university and thought accounting, oh, what's this kinesiology? I just was drawn to it.
Yeah.
And then at this point, she is in Moncton, so I don't get to see her a ton, but every day what did you do for exercise? I did this, I did this one, so that's great. But then locally, my husband, he plays a huge role in why I'm active and why my lifestyle is the way it is. He's very, very active himself. He's healthy, kind of follows the same kind of movement guidelines as I do. If one of us is having one of those days where we're like, oh, I don't know if I want to do anything, we have the motivation to kind of get each other up and going and even just simply walk the dogs or So
it's so much easier when your partner is on board with it. I laugh because sometimes Shay isn't always on board with things. I'm like, come on, I just need a little bit of motivation here. But that's really good. That's awesome. In your becoming a chiropractor or where you are now, do you feel there are any barriers in your practice or where you've come to get on your wellness journey with being a chiropractor?
Right off the top of my head, there's always more to learn. So if maybe not a specific barrier, but kind of an overall, you have those days where you're like, I've done so many courses and I've learned all of this stuff, but I feel like I know nothing. And then you have those really good days where, you just feel like everything came easy and you understand, all your knowledge comes out and it works well with patients and people are getting better. But then you get those cases where you're kind of stuck on and you're thinking about it when you're driving home and you're thinking about it when you're trying to fall asleep. I think time is a huge barrier. I am the type of person that every day I'm like, okay, I need another 20 hours to fit in what I want to do because it's already 9:30 and I want to do this and this, and my to-do list actually never ends because one of these days maybe it will. And then that kind of goes back to learning because there's so many different courses out there that I'd like to take in continuing education, but I kind of have to prioritize the focus I'm putting into the business and work itself. So, I mean, I'm required to do a certain amount per year, so I always get those in, but there's so many that other courses and things that I'd like to get into. So.
Yeah. And, like, I mean, it's the same with anyone's job. I mean, you can go to work, leave it, come home, and it'd be fine. But when you run your own business in your own clinic, you never drop it, right? You carry it with you everywhere. So, do you find it hard to keep that work-life balance, especially when you and your husband are who run the clinic?
Yeah, we've had discussions about, okay, it's 7:30, we can't talk about cases anymore, we can't, and I mean, there's obviously exceptions, like different admin work, like, I honestly don't mind doing that stuff, and it doesn't always really feel like work, because I can do it when I'm doing other things. That being said, I do think it's really important to kind of take time and try and get away, so even if it's taking a day on the weekend and just shutting everything off. We do, at this point, we don't work on weekends, but it's not out of the question for the future. We're treating patients, I should say. We work doing lots of other things.
Yeah.
So, yeah, I think both of our motivation and kind of like enjoyment of exercise and fitness and that sort of thing kind of helps us keep that balance. I have kind of made a point in my long days when I am at Hybrid to take a 2 or 2.5 hour break in the middle of the day, do a workout, eat, recharge, shower, and then I'm right back to treating.
Yep.
And that's what probably only been in the past 6 months or so, and I think that's made a huge difference in even my ability to interact and treat patients, because my energy level is way up again in the middle of the day. And I mean, I don't know if some people would think, oh, you should be working your full, 10 hours that you're there, but I've found that I'm just much better at what I do because of taking that break in the middle of the day, and the week doesn't, I don't really necessarily find any week feels super long, but because I love going to work. Yeah. But that just makes a huge difference.
Yeah.
Day to day.
And it's such a big, when you're dealing with people one-on-one and you're, taking on their energy and listening to what they have to say, it can be it's very rewarding, but it can also become very draining when it's a long day and you see so many people, right? So it's so important to take that time, whether it is for a workout or a walk or eating food. And I just still can't believe, like, when I talk to my clients, I'm like, oh, like, kind of give me your work week schedule type of thing, and they're like, oh, I work 10 hours, blah blah blah. I'm like, okay, what was your lunch? I'm like, oh, I eat my lunch at my desk, I don't take a lunch. I still can't believe that people work in that mental state through their entire day without taking a break. Like, and it's not hard. Like, I'm sure, like, if you had the opportunity, you could just continue to work, because the day flies by sometimes, right? But to be intentional with taking that break is super important. Yeah, that's awesome. And then kind of like over the years, or like even like where you're at right now. So you were mentioning that you can do courses and like you have to do certain things each to kind of keep up to your, would it be like to keep your license? Is that what? Yes. Okay. So right now, like, what do you kind of specialize in now as a chiropractor, or do you specialize in anything specific?
I wouldn't say I specialize in anything specific. Kind of at Hybrid, there's a lot of athletes. So with athletes comes more acute injuries. So not necessarily specialization, but something I see really often and that I enjoy treating. Athletes, we can go with ankle sprain, like knee pain from running, anything along those lines. They're really specific things, and athletes are really eager to get better. Yeah. So that's something that I quite enjoy treating. Other than that, there's a huge variety of things, and going back to not necessarily specializing, but enjoying treating. So, yeah.
So would you say with the courses that you're, thinking long term that you're looking at, is there any information you want to say, like it might be secret or you're not sure yet, but is there any route that you feel yourself going down? Like, I know some people specialize in prenatal, or some people go specific athletes. Is there a way that you feel with that?
A few courses I have taken are about specific assessments for athletes. Not necessarily athletes, like, kind of in my head, everyone's an athlete in their own way. Yep. It doesn't have to be because you play soccer or you play hockey. Your day-to-day life. Whether you're playing with your kids on the weekend or walking your dog or anything like that. So there's been some neat assessments with mobility and movement, things that I've learned over the past few years. Probably if I had to pick something that I do eventually want to focus on, it just hasn't, it's on that to-do list, maybe a little further down because there's some other things to do, is pregnancy, like women and pregnancy. And I mean, we learn about it, and I've treated a fair amount of pregnant women, but I have a pretty strong interest in kind of what's going on and why they have that type of pain during pregnancy, after pregnancy, those sort of things, because their body mechanics change so much.
Yeah.
And it's just not something that when we learned about it in school, you kind of learn baseline, you understand, but there's absolutely a lot more to it. So I think in the future that's something that I would want to focus on more myself, and for the community. Like, there's so many people in the gym and in my life, really, that are pregnant or plan to be pregnant, and I would love to be able to help them.
Yeah. And, like, what type of length of those courses would that be? Would that be, like, a whole other year, or would that be, like...
I mean, most of them are weekend, like, not just one weekend, maybe one weekend, maybe a couple weekends.
Yeah.
But kind of the information you come out of there with, like, you definitely can't take it all in within that time, and that gives you kind of the resources to understand and learn more.
Yeah. That's awesome. So we talked about your wellness journey and how you think that one of the biggest staples in your health is definitely movement, whether that be walking the dogs or exercise or things like that. Definitely eating healthy. But what about, like, products? Is there anything that you specifically take that you think is really a general product that maybe everyone could benefit from for their health, whether that's, like, muscle or joint or bone, whatever that might be?
Yeah. I do take quite a bit of vitamins, supplements. The one I have liked the most recently is a magnesium supplement. I've tried a lot over the years. And I mean, it's a super important mineral that we're all probably deficient in some way if we did actually test everyone. And it plays such an important role in our body, muscle tissue, nervous system, sleep. There's all kinds of different things like that. And there's so many things in our day-to-day lives that can affect our levels of magnesium. So, any increased stress can inhibit our body from bonding that magnesium and using it properly. Eating unhealthy can sometimes cause some of that to occur. So that's, if I had to pick one, would be a good one that everyone could maybe look into and understand a little bit more. And
yeah, I definitely think, like, when people ask me, they're like, okay, like, what are the general ones? Magnesium's always on the list because honestly, like, everyone is so deficient in it. We just do so many things, right? And I think stress is just such a root cause. And not just, like, I think when people think stress, they just think, oh, I don't have anything on my to-do list. Like, my work schedule isn't that busy. But, like, inflammation, that's stress. Not digesting your food properly, that's stress. Exercising, that's stress. Stress in a good way. Like, we need some type of response. But people just don't think stress in the bigger picture. They just think, like, oh, I'm not that stressed. My life isn't crazy. But it's all those other things, right? Yeah. Magnesium is definitely a big one. So a question I ask everybody is, you're stuck on a flight of 20 different, 20 levels of, you're stuck there with somebody, or, the elevator stops. Like, what's one really good piece of advice from a chiropractor's perspective on life that you would give to that person?
Well, there's a lot of different things that I could tell someone in 20 flights, that's for sure. Most times I could talk forever on something specific. But if I wanted to kind of give a piece of knowledge that would kind of hit home and that I would like everyone to know, it would probably be that pain doesn't always indicate acute tissue damage or injury.
Okay.
Really specific, but we get pain after we do a significant workout because we're using muscles that maybe we haven't used over some time, and that doesn't mean that we've damaged the tissue. Sometimes we've just woken up something that has been maybe lingering. That doesn't necessarily say that overall pain in general should be ignored, but because you should get it checked out by someone for that matter. But oftentimes there's discomfort in doing activity or movement that can actually mean you're using that structure in a way that it needs to be used. So if you encounter pain of some sort, obviously get it looked at, but don't always think that pain equals harm.
Yeah. So, like, you mean, like, kind of, like, after a workout, like, I find, like, you know, if I go a really long run, like, a lot of lactic acid builds up, and I'm like, oh, what is that muscle? Or, like,
maybe I shouldn't have done
yeah,
that.
or, like, you know, a heavy weight training session, you're like, oh, my muscles are so fatigued the next day. Like, that's all, like, a normal type of pain. You're talking, like, if it's, like, you're like, oh, I can't bend over properly to reach my toes type of thing, then that would be something that you would get looked at.
Yeah, and I mean, even getting it looked at, like, a big one is people that will, for example, deadlift, and then they go, I think, I can't deadlift, it hurt my back. And yes, you might be a little bit sore, maybe even for a week or so, but I mean, it's important to kind of build on that and understand that, okay, now that you're sore, you shouldn't just freeze up and go lay down and rest it away. You should learn why you're sore, learn what movements hurt, and make things feel better, and keep on moving.
Yeah.
And not to be afraid of that.
So would you say that, like, doing an exercise that you have that little bit of muscle stiffness from it, is it better to continue to work with that, build strength in that muscle to reduce the amount of pain that you would get after a workout, or is that damaging it more?
I wouldn't necessarily say damaging it more. I wouldn't say to do the exact same exercise the next day if you have a lot of pain in there, but certainly moving it versus just sitting down on the couch or laying in bed is going to make it feel better faster.
Yeah. I find, like, for myself, like, foam rolling is such a big thing if I'm feeling, like, any type of pain. Like, do you tell your clients to foam roll? Is that a big thing for you?
Yeah, I have a lot of patients that get immediate relief from it. So if that's the case, then go crazy.
Why does it work? Like, how does it work?
It's just a muscle compression, or a tissue compression.
Okay.
So it's kind of like when we do soft tissue therapy, like, we're pushing in the muscle, and any kind of external stimulus actually allows blood flow to head to the area, which is going to help with healing, kind of indirectly, with pain, dysfunction, and those sort of things.
Yeah. Awesome. So. Nice. Well, can you kind of just wrap this up by giving everybody a good few bits on, like, where they can find you, how they can find you, where they can reach you, and
well, we are located at Hybrid Health and Rehabilitation. It's myself as a chiropractor, my husband as a chiropractor, and we have a massage therapist and an athletic therapist. That is located at 822 Rye Street in Peterborough, within the Hybrid Fitness Health Performance Gym, and
which is just off Lansdowne Street,
yes.
Right? Yeah.
And we are there currently Monday to Friday, variable hours depending on the practitioner. But you can find us on both Facebook and Instagram. Our thing is at Hybrid Health and Rehab.
Yep.
And from there you can visit our website, which is hybridhealthandrehab.com.
We'll put all these in the show notes too.
And there's lots of links on there to kind of learn about all the practitioners, learn about find how to book online. We have an online booking system, which makes it really easy for anyone to get in. And with that being said, I believe it's advertised on the website, but we do consultations if you're just unsure if it's kind of what you're looking for, depending on what's going on.
That's perfect, because some people just don't know, right? They'll just, some people are willing to try anything if they're in pain, and they just don't know what they need, right? So that's really awesome.
Yeah.
Great. Thanks again for joining us here today, Shayla, and thank you guys for listening to the podcast. I hope you are inspired, you're a little bit more educated, and you go and book your next appointment with Shayla at Hybrid Health and Rehabilitation. And please like, review, subscribe, comments, leave us any feedback that you want to, and we hope that you are inspired to live wellness on purpose now and for future generations.